Lisa Broyles here with Way to Health MD, and this is the third video in my chronic inflammation series. Today I'm talking about inflammation of the brain, neuroinflammation. First, you need to understand just a little basic anatomy. We're going to be talking about glial cells, which are the structure and protection of the neurons. Your neurons are your thinking cells, okay? And where the neurons connect are called dendrites, like down to synapses. And that matters because there's a substance called acetylcholine that's very important to help your brain cells talk to each other and transmit signal. So neuroinflammation manifests as brain fog, cognitive changes, and also neurodegenerative disorders. I am a Bredesen trained provider for the Apollo Health Recode program, so I'm going to be addressing some of the neuroinflammation causes that Dr. Bredesen discusses and what to do about it. So different things that can cause neuroinflammation include high blood sugar, loss of hormones like estrogen, exposure to toxins like mold, for example. Some people are really sensitive to it. Exposure to infections, so chronic Lyme disease, the LPS bacteria that we talked about in the previous video. So any of these infections can increase the immune activity of brain cells and thereby increase inflammation in the brain. Also protein aggregates, you've heard of amyloid deposition. There is often a genetic component for that, but it is also due to chronic inflammation. And inflammation in all the body systems can cross the blood-brain barrier and upregulate the immune response, creating extra of a substance called substance P, and inflammatory neurotransmitters that are excitatory like corticosteroids, cortisol, norepinephrine. They increase the pain signal in the brain and inflammation in the brain, which makes you feel more anxious, feel more pain, and not be able to think clearly. So other causes include acute injury like head trauma. So I wanted to discuss some different things strategies I use to heal brain inflammation. And one thing is, if you have a history of high cholesterol and you've got some arteries that are starting to get blocked up in the heart or the carotids or say in the legs, you can also have this happening in the brain. And you can get little tiny blood vessels clotted off in the brain. We call this white matter disease on an MRI, for example. So when you get all of these tiny little blocks of blood vessels, this white matter disease, and this is caused by plaque buildup in the arteries, the brain doesn't get enough oxygen, okay? The good news is there's this wonderful thing called neuroplasticity, neuroregeneration. The brain can actually create roads where they've been blocked off. It can create new pathways to attach neurons that have been lost due to damage, due to peripheral vascular disease, like we've discussed, toxins, infections. But this process is very slow, and the brain needs certain nutrients to heal, such as B vitamins, such as choline. So one of the things that I recommend is, if you're not allergic to them, my patients should eat eggs for breakfast every morning if they can. Eggs are your most important dietary source of choline, which your body uses to make acetylcholine. And acetylcholine turns up the signal. It's like a fuzzy radio when you don't have enough acetylcholine, and you can dial in that signal for those of us that used to listen to the radio. So acetylcholine helps fine-tune that signal and helps your brain transmit signals effectively from cell to cell and then to the body. So other sources of choline include legumes, seeds like pumpkin seeds or sunflower seeds, liver, and soy. But choline from eggs is definitely the best dietary source. So B vitamins are really important to help the brain, especially folic acid. Methylfolate is usually the best form, and there's many people out there that have a mutation in an enzyme called the MTHFR. I've addressed this in a different video in my genetics series. But when you have a mutation in this, your brain can't use the regular folic acid appropriately, which means when you eat Cheerios fortified with folic acid or bread fortified with folic acid, you can sometimes be doing yourself more harm than good because your body can't use that type of folate effectively because you need the methylfolate. So that's one thing that you can get tested for. So another thing is increasing the brain's ability to get oxygen. Everyone with any cognitive decline should definitely get checked for sleep apnea. If you have sleep apnea, your brain cannot heal. At night is when the brain is healing damage. So you have to have enough oxygen to bring the right nutrients to flush out toxins. So there are some supplements I use for that. In certain patients, a supplement called methylene blue is appropriate. Some patients, hyperbaric oxygen in low dose hyperbaric chambers is appropriate. Exercise with oxygen therapy, increased exercise, increased nitric oxide foods like beets. Beet powder is wonderful for healing vascular damage, for helping to dilate blood vessels, lower blood pressure a little bit. All of that helps with neuroinflammation and cognitive decline. You need to get enough sleep. I highly encourage you to wear a sleep monitor like an Oura Ring, or have some sleep buds that track your sleep data. You need to know, are you getting enough deep sleep? Again, this is when the brain heals. This is crucial. So also keeping that brain busy, okay? So you can reestablish connections where they've been lost when you're doing brain games. Brain HQ is a well-studied company. Dr. Bredesen's got some good studies showing that Brain HQ, 10 minutes a day of doing Brain HQ games, which are available online with a subscription, can help your brain to heal areas where you've had a stroke, or you do puzzles, learn a new instrument, try to learn a new language, okay? These are important. Keep your brain busy and minimize screen time. Also, detoxing. You may be sensitive to mold or mercury or pesticides, so it's important to do things like the liver cleanse. You can refer to my video on that. Infrared saunas, again, exercise, hyperbaric oxygen, these all help you to flush toxins, glutathione. You need to treat any infections. Those need to be found, such as Lyme disease or LPS endotoxin in the gut. There are some other supplements like R-lipoic acid and acetyl L-carnitine and the B vitamins I mentioned that can all help the body make more acetylcholine. There is a supplement I do use by Designs for Health called NeuroRenew that does have most of these supplements in one bottle, so that's kind of nice. So basically, in order to let the brain heal, you have to give it the right nutrients, you have to give it enough sleep, enough oxygen, and you have to detox. So that's basic synopsis on chronic neuroinflammation. I would love to talk to you more in person. Thank you.